So about me, I'm 34. I am a roller skater. That is my main part of my personality. I am a service user of mental health services, but I'm also an employee of mental health services of Sheffield Health and Social Care. So my role in the Trust is in medical education and research. It's a lived experience role, so I'm using my lived experience of mental illness to improve the research in the Trust, get more service users involved in having their voice heard. And then in the education department, it's about teaching the doctors of tomorrow and nurses of tomorrow, and sometimes trained staff, and bringing that lived experience point of view. So I have been in mental health services since I was 17. So I have a lot of years of lived experience and a lot of experience in a variety of different services. I've got I've been hospitalised a lot of times. I've had good experiences. I've had bad experiences, and it's always been something that I've been told: you're never going to work, you're not going to be able to hold down a job, you're going to be on medication the rest of your life, you're going to be in and out of hospital the rest of your life. And being able to have the opportunity to turn that around into, like, turning the negative into a positive has been it's been a really powerful thing in terms of my personal journey. Because ultimately I wouldn't be able to do the job that I'm doing if I hadn't have had those experiences, some of which aren't that good. That sounds really minor, but I do quite often get told that it's quite nice to see someone who's, like, you know, got colourful hair, roller skates to work. Like, I definitely, like, don't hide who I am at all at work, and initially I was quite anxious about that, but actually I get quite a lot of feedback about that, and that helps me in terms of, like, how I do my role. I chair a lot of meetings, I facilitate a lot of meetings, and I will make them we'll get stuff done, but it'll be kind of informal. It'll be comfortable for people to join, because I'm quite I'm quite like that myself. I definitely don't come across as being a sort of, you know, business suit type person, and I think that sometimes makes people more comfortable bringing their own sort of lived experience as well. For me, my every day is a challenge. Like, my mental illness is my disability, and I know there's a lot of people who don't identify with mental health problems being a disability, and for me, I was the same for many years, but I sort of went through that process a couple of years ago of, like, accepting that it was something actually that disabled me in life, but that actually has been something that's been really helpful to, like, help me move forward and learn ways to sort of overcome barriers. So for me, even just being in a building and getting into a building is a challenge for me. Like access issues, I have PTSD, and it causes a lot of issues with, like, feeling trapped if I'm not careful. So just walking into a building can be really, really challenging for me. A new building, or some buildings that I know I've been in and are not really set out in a way that makes me feel sort of safe, can be a really big issue. And that's been from day one, that's been something that's been complicated at work. And I'm really, really fortunate that I've got colleagues that are willing to know about that and, like, accept that that's a thing, and sort of support me to be able to physically get into the office. So for me, that is the biggest challenge. It's been really important in our journey of having me here, is that I'm not pressured into, you have to do this right now. Like, I'm very much given the autonomy from my managers. Like, we know that you'll get the work done when you're able to get the work done, and that's been so important to take that, because I give enough pressure to myself to do that. So it's really helpful that they don't put extra pressure on me for that, and they make it very clear that they trust me to do my job how it works for me and my mental illness. Stigma and discrimination is everywhere, whether it's open or whether it's like subtle. I very often get told, you're on roller skates, or you're doing this physical activity, you're obviously walking around and look healthy. So, for example, I quite often get told, if you're like that, then why can't you wear a mask? And actually, I can't wear a mask because, as I've said, my mental illness means I struggle with feeling trapped, and that's a very trapping thing for me, and it will cause me to have quite a lot of anxiety and probably not be able to function. What I've got on my feet or what I'm wearing doesn't make any difference to that. So I do find it really frustrating that people look at me and say, well, you can't be disabled, or you should just be able to do this because you look fine, or you're able to talk about it, so therefore it must be fine. I've been incredibly fortunate that from day one of working in this role, my disability was accepted. I actually had to change the time of my job interview because the original interview was scheduled over the time when the fire alarm would have sounded, and that's not a helpful thing for me. So straight off, I had to say to my future managers, I can't manage this. Could there be an accommodation made? And I remember being really anxious about doing that because in previous jobs, I've asked that and been met with no, or even actually been sacked from the job because of my disability, as I've lost more than one job directly because people have said, we don't want someone like you working for us. So I was very anxious about bringing that, but it was met with, yes, no problem, we'll do something to accommodate it. And that has been how it's carried on ever since. It's really important, and it's something that I really want to let other people know. When you're applying for a job, for example, and you see that box that says tick if you have a disability, if you tick that box really does, it helps your employer be able to make the accommodations for you that you need. It helps start that conversation off. And I've had a lot of negative experiences in the past with declaring my disability, but now I've had a positive one. I don't think I'm ever going to not declare it in the future, because I've learned how I can ask for what I need, and it's difficult, and I haven't always got what I need straight away. It's sometimes been a bit of a battle, which has been stressful, but it's important to ask, because if you don't ask, then people can't help you. So the iceberg image that I drew was to show how much effort goes into being an employee with a disability, where we are so good at hiding our disabilities a lot of the time, and just getting on with it, and people don't necessarily know what we're doing under the surface, just to be on a level floating with our sort of able-bodied colleagues.